Medical Destiny uploads educational and informational videos related to health and medical topics. If you would like to get such kinds of videos, kindly subscribe our channel.
Nclex-Rn exam questions with answers. (456). A nurse caring for a client with end-stage renal failure is asked by a family member about advance directives. Which statements should the nurse include when discussing advance directives with the client's family member? Select all that apply. 1. 2 witnesses, either a relative or physician, are needed when the client signs a living will. 2. The determination of decisional capacity of a client is usually made by the physician and family. 3. A healthcare proxy can write a living will for a client if the client becomes incompetent and unable to do so. 4. Living wills are written documents that direct treatment in accordance with the client's wishes in the event of a terminal illness or condition. 5. Under the Patient Self-Determination Act, it must be documented in the client's record whether the client has signed an advance directive. 6. For advance directives to be enforceable, the client must be legally incompetent or lack decisional capacity to make decisions regarding healthcare treatment. Answer: 2, 4, 5, 6. Rationale: the two basic advance directives are living wills and durable powers of attorney for healthcare. Under the PSTA, it must be documented in the client's record whether the client has signed an advance directive. For living wills or durable powers of attorney for healthcare to be enforceable, the client must be legally incompetent or lack decisional capacity to make decisions regarding healthcare treatment. The determination of decisional capacity is usually made by the physician and family, whereas the determination of legal competency is made by a judge. Living wills are written documents that direct treatment in accordance with the client's wishes in the event of a terminal illness or condition. Generally, 2 witnesses, neither of whom can be a relative or physician, are needed when the client signs the document. A durable power of attorney for healthcare designates an agent, surrogate, or proxy to make healthcare decisions if and when the client is no longer able to make decisions on his or her own behalf. However, a healthcare proxy cannot legally write a living will for a client. 457. A client asks the nurse how to become an organ donor. Which does the nurse include in client teaching? 1. The client can donate with written consent. 2. A family member must witness the consent. 3. The donor must be older than 21 years of age. 4. A family member must be present when a client consents to organ donation. Answer: 1. Rationale: the client has the right to donate her or his own organs for transplantation, and any person who is 18 years of age or older may become an organ donor by written consent without the permission or presence of the family. In the absence of suitable documentation, a family member or legal guardian can authorize donation of the decedent's organs. 458. A registered nurse is providing post-mortem care for a deceased client whose eyes will be donated. Which nursing action does the nurse anticipate will most likely be prescribed that will provide sound care of the client's body? 1. Closing the eyes and placing the bed flat. 2. Maintaining the client in a supine position. 3. Placing a small ice pack on the gauze pads. 4. Placing the client in a lateral recumbent position. Answer: 3. Rationale: when a corneal donor dies, the eyes are closed and usually the physician prescribes to place gauze pads wet with saline over them with a small ice pack. Within 2 to 4 hours the eyes are enucleated, and the corneas are usually transplanted within 24 to 48 hours. The head of the bed should be elevated. With the head of the bed elevated, the eyes will likely remain closed. 459. A clinical nurse manager conducts an in-service educational session for the staff nurses about case management. The clinical nurse manager determines that a review of the material needs to be done if a staff nurse stated that case management 1. Manages client care by managing the client care environment. 2. Maximizes hospital revenues while providing for optimal client care. 3. Represents a primary health prevention focus managed by a single case manager. 4. Is designed to promote appropriate use of hospital personnel and material resources. Answer 3. Rationale. Case management represents an interdisciplinary healthcare delivery system to promote appropriate use of hospital personnel and material resources to maximize hospital revenues while providing for optimal client of care. It manages client care by managing the client care environment and includes assessment and development of a plan of care, coordination of all services, referral, and follow-up. 460. A registered nurse is delegating activities to the nursing staff. Which activities can be safely assigned to the nursing assistant? Select all that apply. 1. Collecting a urine specimen from a client. 2. Obtaining frequent oral temperatures on a client. 3. Assessing a client who returned from the recovery room 6 hours ago. 4. Assisting a post-cardiac catheterization client who needs to lie flat to eat lunch. 5. Accompanying a client being discharged to meet his spouse at the hospital exit door. Answer 1, 2, 5. Rationale. Work that is delegated to others must be consistent with the individual's level of expertise and licensure, if any. Based on the options provided, the least appropriate activities for a nursing assistant would be assessing a client and assisting the post-cardiac catheterization client. The nursing assistant is not trained or educated to safely and accurately perform an assessment on a client. Since the post-cardiac catheterization client needs to eat while lying flat, the client is at risk for aspiration. The remaining 3 options do not include situations that indicate that these activities carry foreseeable risk. 461. A nurse manager is reviewing the critical parts of the clients on the nursing unit. The nurse manager collaborates with each nurse assigned to the clients and performs a variance analysis. Which of the following would indicate the need for further action and analysis? 1. A client is performing his own colostomy care. 2. Purulent drainage is noted from a postoperative wound incision. 3. A 1-day postoperative client has a temperature of 98.8 Fahrenheit. 4. A client newly diagnosed with diabetes mellitus is preparing his own insulin for injection. Answer 2. Rationale. Variances are actual deviations or detours from the critical paths. Variances can be either positive or negative, or avoidable or unavoidable, and can be caused by a variety of things. Positive variance occurs when the client achieves maximum benefit and is discharged earlier than anticipated. Negative variance occurs when untoward events prevent a timely discharge. Variance analysis occurs continually to anticipate and recognize negative variance early so that appropriate action can be taken. Option 2 is the only option that identifies the need for further action. 462. A nurse is planning the client assignments for the shift. Which client should the nurse assign to the nursing assistant? 1. A client requiring dressing changes. 2. A client requiring frequent ambulation. 3. A client with diabetes mellitus requiring daily insulin and reinforcement of dietary measures. 4. A client on a bowel management program requiring rectal suppositories and a daily enema. Answer 2. Rationale. Assignment of tasks to the nursing assistant needs to be made based on job description, level of clinical competence, and state law. Options 1, 3, and 4 involve care that requires the skill of a licensed nurse. The client described in option 2 has needs that can be met by a nursing assistant. 463. A psychotic client is pacing, agitated, and presenting with aggressive gestures. The client's speech pattern is rapid, and the client's affect is belligerent. Based on these objective data, the immediate priority of care is to 1. Provide safety for the client and other clients on the unit. 2. Bring the client to a less stimulated area to regain control. 3. Provide the clients on the unit with a sense of comfort and safety. 4. Assist the staff in caring for the client in a controlled environment. Answer 1. Rationale: if a client is exhibiting signs that indicate loss of control, the nurse's immediate priority is to ensure safety for all clients. Option 1 is the only option that addresses the client's and other clients' safety needs. Option 2 addresses the client's needs. Option 3 addresses other clients' needs. Option 4 is not client-centered. 464. A nurse manager is developing an educational session for nursing staff on the components of informed consent and the information to be shared with the client to obtain informed consent. Select the information that the nurse manager should include in the session. Select all that apply. 1. The client needs to be informed of the prognosis if the test, procedure, or treatment is refused. 2. The client cannot refuse a test, procedure, or treatment once the test, procedure, or treatment is started. 3. The name of the persons performing the test or procedure or providing treatment should be documented on the informed consent form. 4. A description of the complications and risks of the test, procedure, or treatment, as well as anticipated pain or discomfort, needs to be explained to the client. 5. The nurse is responsible for obtaining the client's signature on an informed consent form even if the client has questions about the test, procedure, or treatment to be performed. Answer 1, 3, 4. Rationale: informed consent is a person's agreement to allow something to happen based on full disclosure of risks, benefits, alternatives, and consequences of refusal. The physician is responsible for conveying information and obtaining the informed consent. The nurse may be the person who actually ensures that the client signs the informed consent form. However, the nurse does this only after the physician has instructed the client and it has been determined that the client has understood the information. The following factors are required for informed consent: a brief, complete explanation of the test, procedure, or treatment, names and qualifications of persons performing and assisting in the test, procedure, or treatment, a description of the complications and risks as well as anticipated pain or discomfort, an explanation of alternative therapies to the proposed test, procedure, or treatment as well as the risks of doing nothing, and his or her right to refuse the test, procedure, or treatment even after it has been started. 465. Restraints have been prescribed for a client who is continuously pulling at his gastrostomy tube. The nurse develops a care plan and determines that which of the following are unexpected outcomes related to the use of restraints. Select all that apply. 1. The client is agitated. 2. The client's left hand is pale and cold. 3. The client's skin under the restraint is red. 4. The client verbalizes the reason for the restraints. 5. The client is unable to reach the gastrostomy tube with his hands. 6. The client slips his hand out of the restraint and pulls at his gastrostomy tube. Answer 1, 2, 3, 6. Rationale: A physical restraint is a mechanical or physical device used to immobilize a client or extremity. The restraint restricts freedom of movement. Unexpected outcomes in the use of restraints include signs of impaired skin integrity such as redness or skin breakdown, altered neurovascular status such as cyanosis, pallor, coldness of the skin, or complaints of tingling, numbness, or pain, increased confusion, disorientation, or agitation, or escape from the restraint device resulting in a fall or injury. Client verbalization of the reason for the restraints and the client's inability to reach the gastrostomy tube with his hands are expected outcomes. 466. A nurse is discussing accident prevention with the family of an older client who is being discharged from the hospital after having hip surgery. Which physical factors place the client at risk for injury in the home? Select all that apply. 1. A nightlight in the bathroom. 2. Elevated toilet seat with armrests. 3. Cooking equipment such as a stove. 4. Smoke and carbon monoxide detectors. 5. A low thermostat setting on the water heater. 6. Common household objects such as a doormat. Answer 3, 6. Rationale: physical hazards in the environment place the client at risk for accidental injury and death. Adequate lighting such as nightlights in dark hallways and bathrooms reduces the physical hazard by illuminating areas in which a person moves about. An elevated toilet seat with armrests and non-slip strips on the floor in front of the toilet are useful in reducing falls in the bathroom. Cooking equipment and appliances, particularly stoves, can be a main source for in-home fires and fire injuries. Smoke and carbon monoxide detectors should be placed throughout the home to alert members of the household of a potential danger. A low thermostat setting on the water heater reduces the risk of burns during water use such as bathing or showering. Injuries in the home frequently result from tripping over or coming into contact with common household objects such as a doormat, small rugs on the floor or stairs, or clutter around the house. 467. A nurse is caring for a client receiving parenteral nutrition. Which does the nurse implement to decrease the risk of infection? 1. Assesses vital signs at 4-hour intervals. 2. Administers prophylactic antimicrobial agents. 3. Checks the solution's label against the prescription. 4. Uses aseptic technique in handling the PN solution. Answer 4. Rationale: clients receiving PN are at high risk for developing infection because the concentrated glucose solutions are an excellent medium for bacterial growth. The nurse reduces the client's risk of infection by using aseptic technique when handling all equipment and solutions related to the PN infusion. Option 1 is a reasonable intervention for early detection of infection but does not prevent infection. Prophylactic antibiotics are not indicated for PN infusions and can contribute to the development of secondary infections. The nurse implements option 3 to ensure that the client receives the correct infusion. 468. The home care nurse is assisting a client in managing cancer pain. To ensure that the client has adequate and safe pain control, the nurse plans to 1. Rely totally on prescription and over-the-counter medications to relieve pain. 2. Keep a baseline level of pain so that the client does not become sedated or addicted. 3. Try multiple medication modalities for pain relief to get the maximum pain relief effect. 4. Start with low doses of medication and gradually increase to a dose that relieves pain, not exceeding the maximum daily dose. Answer 4. Rationale: safe pain control includes starting with low doses and working up to a dose of medication that relieves the pain. Option 1 does not take into account other nursing interventions that may relieve pain, such as massage, therapeutic touch, or music. Maintaining a baseline level of pain to avoid sedation or addiction is not appropriate practice, unless the client requests this, and this information has not been provided in the case situation. Multiple medication modalities interventions can be unsafe and ineffective. 469. The home care nurse provides medication instructions to a client. To ensure that the client self-administers medication safely in the home, the nurse, 1. Performs a pill count of each prescription bottle at every home visit. 2. Instructs the client to double up on a medication when a dose is missed. 3. Demonstrates the proper procedure for self-administration of medications. 4. Asks the client to explain and demonstrate self-administration procedures. Answer: 4. Rationale: to ensure safe administration of medication, the nurse asks the client to explain and demonstrate correct self-administration of medication procedures because demonstrating the proper procedure for the client does not ensure that the client can safely perform any procedure. Usually it is not acceptable to double up on missed medication, and conducting a pill count on each visit is unrealistic and disrespectful. 470. A client remains in atrial fibrillation with rapid ventricular response despite pharmacological intervention. Synchronous cardioversion is scheduled to convert the rapid rhythm. The nurse plans for implementation of which important action to ensure safety and prevent complications of this procedure? 1. Cardiovert the client at 360 joules. 2. Sedate the client before cardioversion. 3. Ensure that emergency equipment is available. 4. Ensure that the defibrillator is set on the synchronous mode. Answer: 4. Rationale: cardioversion is similar to defibrillation with two major exceptions. 1. The countershock is synchronized to occur during ventricular depolarization, and 2. Less energy is used for the countershock. The rationale for delivering the shock during the QRS complex is to prevent the shock from being delivered during repolarization, often termed the vulnerable period. If the shock is delivered during this period, the resulting complication is ventricular fibrillation. It is crucial that the defibrillator is set on the synchronous mode for a successful cardioversion. Cardioversion usually begins with 50 to 100 joules. Options 2 and 3 will not prevent complications. 471. A client with a diagnosis of thrombophlebitis is being treated with heparin sodium therapy. In planning a safe environment, the nurse ensures that which medication is available if the client develops a significant bleeding problem. 1. Protamine sulfate. 2. Fresh frozen plasma. 3. Streptokinase. 4. Phytonadione. Vitamin K. Answer: 1. Rationale: protamine sulfate is the antidote for heparin sodium. Fresh frozen plasma may be used for bleeding related to warfarin therapy. Streptokinase is a thrombolytic agent used to dissolve blood clots. Phytonadione is the antidote for warfarin. 472. The nurse is teaching a client with cardiomyopathy about home care safety measures. The nurse should provide instruction on which most important measure to ensure client safety. 1. Reporting pain. 2. Taking vasodilators. 3. Avoiding over-the-counter medications. 4. Moving slowly from a sitting to a standing position. Answer: 4. Rationale: orthostatic changes can occur in the client with cardiomyopathy as a result of venous return obstruction. Sudden changes in blood pressure may lead to falls. Vasodilators are not normally prescribed for the client with cardiomyopathy. Options 1 and 3, although important, are not directly related to the issue of safety. 473. The nurse instructs a client with a diagnosis of atrial fibrillation to use an electric razor for shaving. The nurse tells the client that the importance of its use is that 1. Cuts need to be avoided. 2. Any cut may cause infection. 3. Electric razors can be disinfected. 4. All straight razors contain bacteria. Answer: 1. Rationale: clients with atrial fibrillation are placed on anticoagulants to prevent thrombus formation and possible stroke. Therefore, measures to prevent bleeding need to be taught to the client. The importance of use of an electric razor is to prevent cuts and possible bleeding. Not all cuts cause infection and not all straight razors contain bacteria. Electric razors can be cleaned but usually cannot be disinfected. Additionally, options 2, 3, and 4 are all unrelated to the subject of bleeding, rather, they relate to infection. 474. A cardiac catheterization, using the femoral artery approach, is performed to assess the degree of coronary artery thrombosis in a client. The nurse should implement which actions in the post-procedure period? Select all that apply. 1. Restricting visitors. 2. Checking the client's groin for bleeding. 3. Encouraging the client to increase fluid intake. 4. Placing the client's bed in the high Fowler's position. 5. Instructing the client to move the toes when checking circulation, motion, and sensation. Answer: 2, 3, 5. Rationale: immediately after a cardiac catheterization with the femoral artery approach, the client should not flex or hyperextend the affected leg to avoid blood vessel occlusion or hemorrhage. Placing the client in the high Fowler's position increases the risk of occlusion or hemorrhage. The groin is checked for bleeding, and if any occurs, the nurse immediately places pressure on the site and asks another healthcare provider to contact the physician. Fluids are encouraged to assist in removing the contrast medium from the body. Asking the client to move the toes is done to assess motion, which could be impaired if a hematoma or thrombus was developing. There is no need to restrict visitors. 475. A nurse is reviewing general injury prevention information with the staff of the pediatric department in the hospital. Identify the interventions that the nurse should review to promote safety specifically for infants and toddlers. Select all that apply. 1. Ensure that crib sides are up. 2. Place large, soft pillows in the crib. 3. Use large, soft toys without small parts. 4. Attach a pacifier to a stretchable piece of ribbon and pin to the infant's clothing. 5. Ensure that an infant or toddler is never left unattended while lying on a changing table. 6. Allow a toddler who is toilet training to stay in the bathroom alone to provide privacy. Answer: 1, 3, 5. Rationale: to promote safety for infants and toddlers, crib sides should never be left down because the child could roll and fall. For this same reason, an infant or toddler is never left unattended while lying on a changing table. Pillows, stuffed toys, comforters, or other objects should not be placed in the crib because the child can become entwined in these items and suffocate. Large, soft toys without small parts should be used because small parts can become dislodged and choking and aspiration may occur. Pacifiers should not be attached to string or ribbon because of the risk associated with choking. The child is never left alone in the bathroom, in the tub, or near any other water source because of the risk of drowning.
Thanks for watching. If you like this video and you would like to watch similar videos in future, please subscribe our channel and tap the bell icon.